Welcome everybody to another episode of Dad Bod Life. Today we're here to interview Joni from Freespirit Massage. She's a local massage therapist that specializes in health and wellness, which is exactly what we're trying to promote here in our community. Her office is out of Mariner Chiropractic in Silverdale, Washington. And come on in and follow me and see what she has to offer. Right this way, guys. Almost there, everybody. So excited to get relaxed and de-stressed. I have a very special guest, Joni with Freespirit Massage. Welcome to the episode of Dad Bod Life, Joni. Thank you very much for giving us your time.
Thank you for having me.
So just to start right off, what actually got you into massage therapy?
Well, long story short, I had a family member that ended up in the hospital for a few months, and she wasn't doing well, and she had a lot of poor circulation going on. Her legs would turn purple. And so my mom and I would go take care of her in the evenings, and I would massage her legs to get that circulation going. And when we left, my mom had asked me one day if I had thought about massage, and I said I had not. And so I went and did some research, and within a week I had an appointment with a massage school to have an interview and kind of check out the school, see if it was right for me. And within 2 weeks I was enrolled in school.
Wow.
And here I am almost 16 years later, loving every minute.
That's fantastic. It's kind of cool when life kind of presents you an opportunity and you seize it.
Yes.
And it's exactly what you wanted to do. Mm-hmm. That's fantastic. So many people don't know what they want to do, even in the 40s and 50s.
Well, I didn't know that I wanted to do it, but I've
got
been
a natural
very
talent.
happy. Yes.
So what type of massages do you specialize in?
I mostly see people who have been in motor vehicle accidents, work injuries or slips and falls, home injuries, repetitive stress injuries, and I also do relaxation, pregnancy, so I do a lot of whatever.
Okay. Do you work with other types of treatments such as, I don't know, physical therapy, chiropractic, and how does that correlate with massage in terms of the overall treatment with the client or patient?
Yeah, so depending on what's going on with somebody, it's actually better if they are doing physical therapy and coming in for massage therapy, or even chiropractic and massage therapy. People who tend to do both, one or the other, depending on what is going on with them, actually heal quicker.
Really?
Yes, even if they don't feel like that treatment is helping them at the time, we notice that they get better much faster than somebody that is only doing massage or only doing chiropractic or only doing physical therapy.
Do you see the massage helping, say, reduce inflammation, things of that nature? Is that one of the primary categories that you see when somebody, say you have an arthritic patient or something along those lines? Inflammation obviously is a catchword these days. How do you treat somebody with arthritis or
well, the big thing with arthritis is you want to keep your range of motion that you already have. There's nothing that you can really do physically and massage-wise as far as the arthritis damage that you already have, but you want to keep the mobility that you already have. So things like stretching and even strengthening will help reduce how quickly arthritis will take over a joint.
Do you ever notice patients or clients of yours that don't necessarily want to stick to the entire range of treatments, meaning they're going to give up on the chiropractics or maybe they give up on the massage and then...
I would say your average client, most of the people that will come in eventually want to maybe not finish all of their treatment, or they just slowly are like, this one doesn't feel like it's doing anything, so I'm only gonna get massage, or the adjustments are working the best, so I like feeling that crack, you know, and then some people are like, I don't want to feel any of that. I just want to relax and make the pain go away, you know.
Do you find that those individuals tend to be more pharmaceutically driven than naturopathic or holistically driven in terms of their treatments?
It really depends on the individual. I've seen both scenarios go both ways. So, I mean, a lot of it has to do with your belief system. But regardless of what you choose, it takes time and it takes a lot of effort, mentally, physically, consistency. Is
Obviously,
the key.
Rome wasn't built in a day. The human body isn't going to. You got damaged really quick, but you can't repair really quick. Unfortunately,
Yeah. So, yeah, it's unfortunate that your healing can't happen as quick as that slip and fall in the pavement did. Wouldn't that be nice?
Yeah, it would be nice. So, a lot of individuals, I've noticed, they buy massage packages for, say, their significant other, wife, husband, otherwise a partner. What type of people or clientele, when they come in, are you offering a treatment, or is it more for relaxation when they come in on that circumstance? Say there's no injury, but they're just like, hey, I want to take care of my wife or my husband. How do you approach those types of clients?
So that is something, one, that's going to be different every place you go to. Everybody has their policy on how they like to do that. For me, you're not buying a specific package or treatment from me. You're purchasing me for an allotted time. And I will sit with the person when they come in, and we'll do like a little consult, see what they're looking for, what they want out of their massage, and I will cater to whatever they're looking for.
That's very interesting. Just as a backtrack, talking about your therapeutic things, do you ever work with other modalities such as like Chinese or Eastern medicine, any of that? So do you work hand in hand with those type of therapists as well?
I personally do not. I am not trained in any of those, but there's lots of people that are a lot of really cool different things out there. But as of now, I don't.
As of now, you don't.
As of
Okay,
now.
fair enough. Age ranges. Do you have a specific set group that you work with, or oldest to youngest? I mean, can you give me a range of your youngest client to say your oldest client, and does massage just work for everybody, would you say?
It does, yes.
Okay.
It does. The youngest I've worked on is a day old, which my own children. And the oldest was probably about 94 years old.
94 years old.
Mm-hmm.
Wow.
Yes.
That is incredible. That
Yep.
sounds great.
And everything in between.
Everything in between, yeah.
Yes.
So, I mean, where we live, specifically in this area in Kitsap, we have a lot of people in the trades.
Yes.
I'm sure that you see a lot of people that are injured from repetitive injuries, things of that nature. What can you offer for someone that's a welder or a carpenter or someone that's in awkward positions all day? How do you work on those specific clients?
That is a tough one because, like I said, I really individualize my treatments to the person. So there's a lot of little general things that really everyone should be doing, even if you don't have a physical job. So taking the time to stretch throughout your day, neck, shoulders, just kind of breathe, open up the chest cavity, even wrists, whether you're at a desk job or you're doing physical work. But past that, I really, really cater to my clients because people are going to have different issues even if they have the same job, because your personal stress can also determine what is going on in your body. And also if you have any underlying issues or previous injuries.
That's
So
very interesting.
Yeah. So there's a lot of things that come into play. That's why you can't just say, you'll be healed in 3 weeks.
Dad Bod Life focuses on multiple athletic ranges such as MMA or jiu-jitsu or bodybuilding, CrossFit. Um, is any of your clientele in the bodybuilding industry, or are they athletes of one sort or another? And then what kind of treatments do you offer for maintenance for those athletes?
Good question. I have had a few people kind of on the bodybuilding side. And I have also had high school athletes in here as well. I would say the biggest thing for anybody that does a good amount of physical activity, whether it's sport or just weightlifting, is making sure that you are stretching the muscles properly and getting the soft tissue relaxed.
In terms of stretching, there's a lot of discussion between stretching before a workout or stretching after. What do you recommend, since you work with muscles and that industry?
I feel like that's one of the big debates with a lot of different health industries. But definitely stretching afterwards, especially if specifically with weightlifting. When you're strengthening that muscle, you also want to reduce the stress that's in there. So a lot of times people will not do any stretching of any kind, whether it's before or after, and they end up having a lot of issues where they lose their mobility. So that's the biggest thing that I have seen, is the not loss of mobility, but they just can't, quite as extend as far as they could with any given muscle group.
Okay.
Yeah.
So your recommendation would be definitely after. One of the people that I've discussed, an athlete, said that they find that they can't lift as strong if they stretch before. So I would probably ask, is it depending on the goal of the specific athlete? If it's, if they're just trying to be as strong as possible versus being as flexible as possible, are they willing to sacrifice their mobility over strength?
I think that would be one of the situations where that would be up to an individual and really listening to your body. Everybody's going to be different with certain things. And it's really important, no matter what you're doing, any kind of physical activity, listening to your body. If something doesn't feel right or it feels better doing something a certain way, then I would listen to your body, even if it might be different than what most people do.
I think at this point, that kind of wraps up all the questions that I have. Would you perhaps, I am so excited about this, would you be okay with giving me a demonstration of some of your massage techniques?
Absolutely.
My shoulders are killing me and my neck is killing me. Could you please demonstrate some of the techniques that you would do?
I would love to.
All right, thank you so much,
You're
Joni.
welcome.
Well, I guess this is the part where what do I need to do? This is my first time doing a massage, so.
Well, normally, we'll have you leave all your clothes on today since we are videoing. Normally, I would have somebody come in. I would ask if they've had massage before, kind of give them the rundown and see what they expect out of the massage. And I like to get a feel for how comfortable people are, because my main goal, no matter what, is that everybody is comfortable in my workspace.
Fair enough.
So normally people would get undressed however they're comfortable. They would be underneath this sheet at all times. And I would leave the room and I would knock before I come in to make sure that they are ready.
Awesome. Well, I'll keep my clothes on for
Yes.
the camera purposes and everybody else's sake. And let's get started on this.
All right, sounds good. All right, I'm just gonna kind of get a feel of what's going on in here before I do anything else.
Okay, so what are you feeling for right now?
So right now I'm just kind of feeling how tight the muscles are, if you have any adhesions anywhere.
Adhesions? What's an adhesion?
Some people like to call them knots or adhesions, and it's just really tight areas and muscles.
Okay.
You can have you have different types of soft tissue in the body, but basically any soft tissue can kind of bind up and attach to itself and other soft tissues.
Oh.
So it can create little spots that, like, can you feel this right here?
Yes, I can.
Yeah, so it can create tender spots, and kind of cause
Wow.
other areas.
I can feel that.
Yeah, just that little
Dang.
bit of pressure can help loosen things up, surprisingly.
Holy smokes.
Yeah, so I'm just going to keep my pressure on here for
I
a
can
second.
feel it in my ear, actually. It's weird.
That's very common.
Really?
Yeah.
It's very
As we
interesting.
put pressure on it, it kind of jolts the system a little bit, and then everything just kind of slowly starts to relax.
Yeah, I can feel that.
You might
Wow.
not feel too much right now, but when you get up, you'll probably feel that spot is a little freer feeling. So I'm just going to run a pass down this shoulder blade area.
Wow.
What are you feeling in there as I'm
I feel like blood is like coming back into my shoulders.
getting some more circulation in the area?
Yeah. Wow. It's like I could feel all the tension in my back kind of just leaving it for a short amount of time. Wow.
I always like to imagine muscles as butter. When you warm it up, it just kind of melts away all the tension.
Yeah. I could definitely feel that.
That's what I always envision in my head when I'm
Wow.
working on people. It's like all the tension just melts away.
Wow.
So do you notice a difference between your left side and your right side now?
Yes, I feel very uneven right now. So
Yeah, if you were to stand up, we would probably notice a difference between the two sides and possibly even your shoulders.
is this reducing inflammation in my shoulder as you're doing this?
What we're doing is releasing lactic acid in the muscles.
Okay.
And you're decreasing the tension, so the muscle's actually relaxing, which in turn increases circulation.
Is this common? My nose feels like it's plugging up at the same time.
Yes, it is. Most people that I get here don't know that. What happens is it's kind of like a traffic jam for your lymphatic system, which is the system that clears the impurities out of the body.
Oh, that's interesting.
And so it kind of ends up being like a little traffic jam in the sinuses because it's working faster than it normally does on its own because we're increasing the circulation in the body.
Holy smokes. Wow, our bodies are so incredible, aren't they? Like just
They are amazing.
just all the different facets of our mind-body connection and muscular, endoskeletal, all that stuff. It's crazy. Nervous system, lymph nodes. Lymph nodes or lymph nodes? What are those?
Lymph nodes.
Lymph nodes, okay.
Yeah. So do you feel a little bit more even?
I do feel even. Would you mind working on my neck a little bit, please?
Yeah, not a problem.
I would really, do I need to turn around?
Yeah, I'm going to have you actually turn around for that.
Okay, I will turn around. Holy smokes.
Would you like pillow under your knees?
No, I don't need it.
Okay. I'm actually going to have you come all the way down
Oh,
towards
yeah.
your feet.
Oh, towards my feet?
Yes, please.
Okay. So when you're working on my neck, what type of muscles are releasing here?
Well, do you happen to have any specific issues that are going on?
I've been getting bad headaches and cramping and I don't know, just
Are you getting headaches more towards the front, side, back?
kind of
Feel
front
like
and
a
side.
helmet all the way around?
Front and side typically.
Okay.
Yeah.
So typically what I have found that causes that is these anterior and side muscles in the neck. They are not always the most pleasant muscles to work on. So if you bear with me for a moment, I'm gonna run a few passes down. You comfortable with that pressure?
Yes. Feels really good, actually.
Oh, good. A lot of times people say it resembles the feeling of kind of being choked because it's right next to the windpipe. So some people become very uncomfortable when you have to work on these muscles.
I feel like something's almost draining or something like that. Is that what's happening right
That's part of the lymphatic system.
now? Wow.
Yeah, and you're right around the ear canal. So and then you have a lot of lymph nodes through here. So you're probably going to feel more drainage when you work on this area versus any other area, as far as the physical feeling of them draining.
It's very interesting.
Pressure okay?
Yes.
All right. How's that feel?
Feels great.
Do you notice any difference? Or do you have a headache right now? I didn't even ask you that.
Actually, my headache has diminished quite a bit.
Good. Yeah, a lot of times what happens is people, like I said before, everything's out in front. And so a lot of times with gravity and work, whether you're doing a physical job or computer, we tend to have our heads forward and down. So these muscles get shortened. Even if you pull your head up, you're not really stretching or lengthening them. So it's really important to get in there and really manually stretch out that muscle, which will reduce headaches in the front and temporal lobe.
Thank you so much, Jody.
Yeah, you
I
are
really
welcome.
appreciate your expertise here. That I feel fantastic.
Good.
All right, I'm going to get up. Is there a specific way that you like people
just
to exit the table, or?
Get up nice and slow. Come up to one side. Sometimes you can get lightheaded.
Okay, especially after you've been working
yes,
on my head.
Absolutely.
Oh, wow, I feel incredible. Joni, thank you so much.
You are so welcome.
Thank you for hosting Dad Bod Life, and you have a wonderful day.
Okay,
Thank you so much.
You too.
Thanks everybody again for joining us in Dad Bod Life. If you like this content, please like and subscribe. Hit that bell button so you can get more of Dad Bod Life content. Again, thank you very much.